Hey guys, it's Dr. J here in the house. Quick chat with y'all today. We'll try to answer some questions on topic if possible. So I just had a phenomenal interview on the Thyroid Reset Summit. We interviewed an amazing guest. I'm not going to tell you her name yet, but great guest. We talked all about the autoimmune diet and autoimmune diseases, essentially. And we talked about natural ways to help address these conditions with diet, with lifestyle, with supplementation, with herbs, with botanical medicine, talking about macronutrients. Now, a couple of things. We talked about what's called a paleo diet or a paleo template. That's our foundation thing. A lot of listeners know what that is. That's nutrient dense, anti-inflammatory, low toxins, healthy proteins, healthy fats, primarily animal fats, but also healthy vegetable fats too. Olive oil, coconut oil, avocado oil, phenomenal. Potentially grass-fed butter or ghee if you could tolerate it. Healthy nuts, healthy seeds, healthy starches as well. No grains, no legumes, no dairy in general. Now, the autoimmune template, and I like the word template because template gives us the word to dial in the macronutrients. Macronutrients are proteins, fats, and carbohydrates. And we can dial those on a percentage basis based on what you need or what you feel best with. So in general, I kind of lean more towards the lower carbohydrate side just because people tend to be consuming excess carbs, either from the just following the foundational food pyramid at 8 to 10 servings of grains a day. It's impossible to be a lower carb on that. And then also just making sure we're getting enough high quality fats because a lot of people are also into this kind of low fat thing and they're not getting good quality fats. They're getting a lot of refined plant-based fats and or trans fats that may not be the best for their health. And then, of course, getting high-quality proteins and really emphasizing macronutrient and micronutrient quality or, the exact quantity per se. So the autoimmune part, we're taking out nuts, seeds, nightshades, and eggs, maybe some certain seeds and seasonings as well, nuts and seeds. And then we're also we're following that along with healthy proteins, healthy fats, no dairy, no nuts, no seeds, healthy carbohydrates, no tomatoes, no potatoes, no eggplants, no peppers. We dial in, try to do more veggies than fruit and starch. And then, of course, our healthy fat. So we do that as a means to reduce inflammation. We do that as a means to increase nutrient density. And we do that as a means of reducing toxicity. So that's huge. And there's a lot of anti-nutrients such as lectins and phytates and various mineral blockers and irritants that we remove naturally. And because of that, we can really help improve gut permeability. And gut permeability is a hallmark of any autoimmune condition. We have our tight junctions start to open up. Undigested food particles slip between these epithelial tight junctions. And these foods then create an immune response because the immune system's like, hey, what the heck are you food particles doing in the bloodstream? So the immune system starts to freak out. The immune system sucks lots of resources and energy away from our body if they're attacking things. And then the surface proteins on these foods look very similar to skin, to muscle, to joint tissue, maybe even to other neurological tissues in the brain like myelin or gangliosides, etc. So you can really start to get this cascade, this immunological cascade of damage and inflammation through bad foods and through this leaky gut mechanism. All right, so any questions here regarding leaky gut? We're going to integrate kind of a plan talk with live questions. I'm the only person online that I know that does that on the functional medicine side, so feel free and chime in. Let's see here. I know some of you all came in with questions maybe not pertinent to that, so if we can dial that in, that'd be super helpful. Let me see if I can figure this out here for y'all. So a couple people want to know about some of the gut testing I do. The gut's really important because we like to look at infections, parasites, H. pylori, fungal overgrowth, yeast overgrowth, dysbiosis. This can have a huge impact on breaking down our foods, keeping our body in a perpetual state of stress, absorbing, utilizing, and assimilating our nutrition. And of course, these foods have there are other types of toxins they produce, such as endotoxin or lipopolysaccharides, that can be an immune stressor and can put more stress on the body. So, cutting those foods out can have a huge beneficial effect. And so we really want to do some testing to get figured that out. And then regarding marijuana, can marijuana cause leaky gut? I mean, I think it depends. If you're consuming marijuana through smoking, there's a lot of compounds such as PAOHs, polyaromatic hydrocarbons, or heterocyclic amines. These compounds through the incineration process of the marijuana or the joint or however you're taking it in can definitely be a stressor on the body and be a strong pro-oxidative stress where you're losing electrons. So that may potentially drive a leaky gut. I think if you're consuming marijuana or CBD types of marijuana, which is the non-psychoactive component in marijuana, through an oil-based or a tincture-based, I think there's less chance of there being a problem because of the fact that you're bypassing a lot of those toxins I just mentioned, the polyaromatic hydrocarbons and or the heterocyclic amine. So I think you bypass some of it. And there's some really important antioxidants and immunobalancing qualities in some of those compounds. And again, if you're consuming a high quality brand where it's being extracted in a way that's not providing solvents that are toxic, I think that definitely helps. Josh writes in, how many patients have trouble processing bile enzymes and HCL don't do the trick? What temporary or not do these people? What temporary or not do you put these people on? So it depends. I mean, if people are having a hard time digesting foods, we try to dial in HCL enzymes, bile salts. If we're having an issue with the HCL burning or irritation, we may use lower doses. We may use bitters. We may use things just like apple cider vinegar and or lemon juice at very lower levels. If we're still having issues, we may, just use more enzymes over anything else. So if we're having problems on the fats, we're going to increase bile salts and or bile or fat digestive enzymes such as lipase to help with that. And we may even just decrease the amount just a bit to put, to take the load off the body, especially if we're seeing it takes excessive amount of wipes or we're seeing a lot of kind of big skid marks on the toilet seat or the stools are just sinking, right? Oil and water separate, right? So the fatty stools will stay more floating at the top. So if we're noticing that, that can tell us a lot about our fat digestion. So this question gets asked a lot regarding our adrenals and dealing with gut and autoimmunity. Will our adrenals heal on their own once the gut is healed? It's hard to say because a lot of people, they're not like on vacation for a year where they can just chill out and take all the stress out of their life. So I think it is possible. It's just much longer and harder road. That's where some of the supplementation comes in to take stress off the body, to support the hormone levels, to buffer the stress. Of course, the healthy diet and lifestyle habits are essential. So it depends. If we're dialing in the exercise, the sleep, the food, the hydration, we're taking all the stressors out of our diet, and then we're adding specific supplementations to help buffer and improve the stress response, then we accelerate the healing so much faster than just dealing with the gut by itself. Some people ask about quinoa. So quinoa has like an amino acid sequence that's similar to gluten. So it's kind of this pseudo seed, pseudo grain. So I typically recommend going autoimmune. We cut that out just to help improve gut healing initially. That may be something we add back in. Now, it's not a super nutrient dense food. So if we add it back in, it should be in on the 20% of the side of the fence, not the 80%. So 80% kind of represents our staples and what we do the most, and the 20% is that kind of minority. So if we throw it back in and we know we can handle it, then it'll go on that 20% side, not the 80%. So some people ask about excessive body hair here. So when we see excessive body hair, kind of connecting that to an autoimmune template, when I see excessive amounts of carbohydrates for females, that can drive insulin, and insulin can definitely drive excessive hair growth. With men, it's similar as well, because with that, you can really drive up DHT, and DHT is a stronger testosterone that tends to drive more hair growth in the hair growth in the ears, the back, the neck area, just the nose area, kind of the abnormal old man hair. That's kind of the DHT hair. So keeping, the estrogens at bay, keeping good zinc and selenium and nutrient levels are going to help with keeping our DHT under control. M&M writes in, HCL tends to make my stomach feel heartburnish after 3 days of taking just a small amount. I assume it's a sign it's not needed. So, I mean, I would drop it down. I would come at a one capsule dose and see if that helps or not. If that doesn't help, I would cut it down to an eighth or even a quarter or a half, and just make sure you're taking it with food. It depends. If you have other types of digestive issues, it may be necessary to take that, especially if you're not breaking food down, or if you have other gut issues. I would just try to taper that dose down and maybe just rely more on HCL and enzymes. You may also have a thinner gut lining, which may make you more susceptible to it. It's like someone that has back pain or needs a massage, but they just got a sunburn, right? they may really need that massage for therapeutic healing, but because their skin's so sensitive, they may not be able to receive it. Jean Story writes in, I'm wondering if Cocci is a form of fungus that tests positive for household air quality, is for mold spores, aspergillus. Not sure that question there, a little broken up. Try writing that again for me. Leslie writes in, how to balance B vitamin levels as a vegan. So you can do nutritional yeast. That's an excellent way to get additional B vitamins, nutritional yeast. I'd also take a really good high quality B vitamin as well and a good multi on top of that. I would strongly urge someone who's a vegan to get a little bit of animal protein if you could do egg yolks or fish, or if you couldn't do that, maybe some mussels or oysters, just something like that could be beneficial. But if you're trying to be strict vegan, then those are some additional options I just gave you. So Jeff writes in, should we do a GI map again? Yeah, we should, but we got to get the inflammation under control and make sure the gut lining is dialed in and cool. If not, we're just going to see a whole bunch more inflammation present. That's a given. Alamo writes in, I already do super healthy, nutrient dense keto. Excessive hair growth has been caused by adrenal supplements. So if we're noticing excessive hair growth by adrenal supplements, I would look at the DHA and I would pull the DHEA out first and see how that helps. It's typically going to be caused by the preg and the DHEA. Again, having done this thousands of times, it tends to be the DHEA, and it happens 1% of the time. So I'd come off the DHEA for like a week and then just gently taper that in, do 1 drop, and then every couple of days increase. But I would just keep the dose very, very, very low. And if you're noticing it's because of adding in DHEA or adding in some of my adrenal support, it's probably the DHEA. So work with that first. Someone writes in about sciatica with my chiro. Does inflammation in the gut worsen it? Well, yeah, because a lot of the muscles from the gut, they're on the same 2-lane sensory nerve highway as the muscles in the lower back and sacrum area. So inflammation in those nerves can definitely, let's say, inhibit optimal neurosignaling to those muscles. So for sure, it's just kind of like have your FM radio going or your AM radio going, but you're going under a bridge. There's kind of this interference that's happening with the radio. It's the same thing with inflammation in the gut versus the optimal performance of the muscles. Those nerves are on the same 2-lane highway and could be a problem. Okay, Leslie writes in about sporebiotics. I love sporebiotics, Bacillus indicus or indicans, Bacillus subtilis, Clausii, coagulans. I provide a product called Mega Sporebiotic, which is great, which has those 4 major strains that can be very beneficial, and they kind of help crosstalk and feed a lot of the Lactobacillus, Acidophilus, and or Bifido species. So they can be very, very helpful. I use them in my line to help support and help heal leaky gut and autoimmunity as well. Can functional medicine cure premature ejaculation? Yes, it can. Premature ejaculation is caused by a decreased parasympathetic nervous system response. Ejaculation is strongly the sympathetic nervous system. The parasympathetic, or foreplay and maintaining arousal, is the parasympathetic. So if you can't maintain arousal, it's because your parasympathetic is down, and then you go right to ejaculations because your sympathetic's in overdrive, right? So that's one of the things you have to work on, is getting the parasympathetic stimulated. Nose breathing, diet, lifestyle, hydration, food, good supplementation, all of that is important. Josh writes in, do you see a low residue or fermentation potential FODMAP as a must for patients dealing with gut dysbiosis or just SIBO? More on the SIBO side, people that really have an improvement with gas and bloating and digestion as they cut out the fermentable carbohydrates, that's an important sign that there's SIBO there, more than likely, because the fermentable carbohydrates are feeding that bacteria. The bacteria is then driving the hydrogen and or the methane overgrowth, which could disrupt motility, cause more diarrhea. Of course, that's going to disrupt the optimal digestion and create stress in the intestine. So starving out those types of bacteria with cutting out the carbs, the fermentable carbs, can help significantly, for sure. And again, it's, we use it as a starvation protocol, and then we come in with herbs afterwards to really decrease the killing there. Leslie writes in, can I take sporebiotics? Although I'm sure I have some sort of candida infection. Not exactly sure if I do, but I have a lot of symptoms of it, such as oral flush and rashes. Yeah. So, I mean, you need to follow the 6R protocol. 6Rs: remove the bad foods, replace the enzymes, acids, repair the gut lining and the hormones, remove the infections, replete, reinoculate probiotics, then retest. So you're going at it in the wrong order. Follow the 6Rs. Is excessive hair growth reversible? Yeah. If it was just from the supplementation, you just dial that dose in and it should return fairly soon. Matt White writes in, I've noticed some benefits from adding in coconut milk in my diet for more calories. I took out FODMAPs. Sometimes it still causes mild gas, but not too much bloating. Would it be okay to continue? Yeah. Yep. That's totally fine. I think it's a really good feedback, and give it a try. What effect does hooked coccyx have on the body? I'm wondering what role it plays in my wacky system. So when you say a hooked coccyx, do you mean like you fell on your sit bone and then you hurt your coccyx? Is that what you're trying to say? I think that's what you mean. Let me just make sure. Yeah, that's exactly what it is. So the coccyx is that basically your tailbone, you fell on it. So a lot of times they'll have you sit on a donut to kind of relieve pressure. If it's truly hooked, there are some chiropractors that do this technique. You may or may not, because it's kind of a med legal thing. They'll do an internal coccyx adjustment, and they'll go in there and they'll do the rectum or the anus, and they'll pull the coccyx back into position. So you may have to reach out and find a doctor that can do that and pull that coccyx back into place. There's some people that will use an external protocol where they pull the ligaments on the outside and kind of use the ligaments as a lever to pull that coccyx back into place. Do you have anything to help with toxic mold exposure? All the doctors where I live say it's overrated. I mean, I do think it's somewhat overrated unless you know your house has mold. If you significantly feel better after leaving your house, that tells me that there's some kind of stressor there. If you can see it or you can get it remediated, great. Use corncrobium afterwards as well and get a good air filter. I have my molecule in the corner. I have an air doctor and an advanced air upstairs. So I have a couple of different air filters. That could be a great way to reduce your mold exposure on top of that. And of course, various binders can be used, such as glutathione, activated charcoal, Pectisol C. You really want to work with a good functional medicine doctor that can help get to the root cause of why there is an issue to begin with. Most people get exposed to mold all the time. It's just there isn't a problem because their glutathione systems and their antioxidant systems are firing at all 6 cylinders, so there's not an issue. So typically it's a susceptibility issue. Let me go back and hit a few other questions here, y'all. Colin writes, in any reason someone would have no traceable levels of pregnenolone on their blood test? Well, that's a sign of significant adrenal dysfunction if that would happen. Excellent. Let's see, any other questions here? I'm just going back at some of the earlier ones I skipped. Any other questions? Very good. So Gabe writes in, I took 6 curcumin pills at the same time the other day, which is more than recommended. Is there any danger in taking this many? Well, that's a really high dose. That's my curcumin supreme, which is a liposomal curcumin, really strong. I mean, if you need it because you're significantly inflamed or you had a really powerful workout or something, I don't think you need a dose that high unless you're truly seeing a benefit going that high. Typically 2 or 3 is pretty good. My wife had a procedure last year and she had to have a surgery. We used a higher dose like that kind of post-surgery to kind of get her off the higher dosed narcotics. And that was great, but that's a higher dose. So it just depends on what your reasoning is and if it's beneficial. If you're seeing a benefit, I'd say. If you are, great. If you want, I drop the dose down. All right, excellent. Yeah, if you go to justinhealth.com/shop under, I think, just type in curcumin supreme or under, I think, nutritional support, you'll see it. Gabe writes in, I'm going on vacation soon to Cancun and I have poor digestion. I know I'll be hyped up or busy to chew food. Is there any risk of taking more than 10 pills of your line of enzyme to help digest? Well, I mean, I would do some HCL and some enzymes. That's number 1. Okay. And I would dose it according to what you need. And then I'd bring activated charcoal for any questionable foods to take it with. I'd also bring a nice bottle of probiotics, and I'd bring GI Clear 4 and 5. I would take 4 and 5 at the first sign of any issues or any questionable food. And you can use it at an acute dose of up to 12 capsules a day, 1 capsule every hour or so if you're acute. And you can also take the probiotics and bring them at a higher dose as well. The probiotics will knock out any type of higher kind of food poisoning, E. coli, Shigella type of exposure. So that's great as well. And then Janine writes in, can you provide info for scheduling an appointment with you? I'm new to YouTube. Yeah, Janine, just go to justinhealth.com and then click the schedule button on the right-hand side and then look for that new patient consult after hours with myself. Click it and schedule, and you are good. All right, any other questions, y'all? Feel free and let me know. I'll give you 30 seconds to pump in there. Again, today's topic was autoimmune, the autoimmune template. And again, feel free and head over to Thyroid Reset Summit, thyroidresetsummit.com, and sign up, subscribe. I got a summit. It's postponed until March, but check it out then. We're going to go live. I interview some of the best experts on thyroid health. It's going to be amazing. And I'm just trying to provide more information to you, to the listeners, to the world, so people can take control of their health, improve their thyroid, improve their autoimmunity, and perform better. Where can one study functional medicine? There's a couple of different programs that are out there. Dr. Kalish is great. The Institute of Functional Medicine is great. There's an NTP program that's great. I'll be having a coaching program at some point really soon, just busy, and that'll be one of the next steps that I'll be working on. Is a good functional medicine program to help people both on the clinical side, but as well as the business side. Alamo writes in, are you sure that body hair growth excessive will revert to earlier? Well, yeah, if you get to the root cause of why it happened, it would drop. So it's probably the DHEA, which, you know, the dose I'm using is 5 or 6 milligrams, which is really low. Like if you look at like Whole Foods and look at any DHEA, typically it comes in 25 milligram dosages. So this is about 75 to 80% less. So if you're having issues, I'd reach out and schedule a consult with myself outside of just pulling that product out. And you could have some sludged up detoxification systems that are holding back your ability to process it and to detoxify it. How do you know if you have Crohn's or ulcerative colitis or just other gut issues? Well, ulcerative colitis and Crohn's fall into this IBD category, irritable bowel disease, where there's a lot of excessive inflammation. So you can usually see a lot of pain. You're going to see a lot of tenderness. You're going to see potential blood in the stool. That pain and tenderness will typically cause you to go to your doctor, who may run a test to look at inflammation in the gut, like calprotectin, and they may run a scope where they do a histological sample and they pull out inflamed cells, or they're able to visualize and see various skip lesions, like in Crohn's, where you have these like stripes, like a zebra stripe that kind of skip. That's a sign of Crohn's, or that's a sign of Crohn's. And then you have ulcerative colitis, which tends to hit more of the colon and the rectum area, and you'll see maybe more blood in the stool. So those are a couple of the hallmark symptoms, along with malabsorption as well. Let's see here, a couple of last questions here. Wondered if my son, age 6, would benefit from intermittent fasting. Maybe. I'd rather have them get enough nutrition. So I'd really focus on getting enough nutrition at age 6. I wouldn't focus on any intermittent fasting unless it kind of just happened naturally. And you'd still want to make sure your kid had a bigger meal later in the day to make up the nutrients that he would need or she would need to be growing. Josh writes in, what type of gut infections can lead to steatorrhea or fat digestion problems or just SIBO or candida? So in general, fat digestive issues, Giardia is a big one that can make its way into the gallbladder and decrease bile secretion. So that's potentially one. Any type of issue that can lower stomach acid, because stomach acid's a really important trigger. That nice low acidity in the stomach helps trigger this hormone release when that bile or that chyme goes into the small intestine. This hormone-like peptides called CCK or cholecystokinin, and that triggers the gallbladder to release. So if we don't have enough acidity in our stomach, when that food gets released into our small intestine, we're not going to squeeze and contract that gallbladder, and we're not going to be able to release it. Also, eating lower fats will keep the gallbladder more stagnant, and it has the effect of just not changing your oil, and it gets kind of really static and stuck and sludgy, and then you can eventually develop crystals. And then those crystals can easily irritate your gallbladder, kind of like hugging a porcupine, right? These crystals start to, form jagged edges, and then you kind of squeeze it when the gallbladder contracts. It can be like hugging a porcupine and cause a lot of inflammation. Jeff writes in, do you have an appointment with me this week? I think I had to reschedule with you, Jeff, but reach out to my staff. I'll make sure we get you in this week if we need to make sure you're on track. And then writes in, DHEA gave me a headache when taking it in the past for tanked out hormones, but I know it's good for you. Yeah, I mean, you should do it in very, very low doses. Do it sublingually. You can even just do 1 drop of it and put it in a glass of water and sip it throughout the day. That way you have a very, very, very low dose. Excellent. I think I hit everything here. Let me just double check. When will I start to successfully reintroduce some foods? I'm done with GI Clear 1, 4, and 5. Well, this is a really important question. A lot of patients that we start off with on an autoimmune template, we like to get them on an autoimmune template for at least a month and or till they flatline. So if they're starting to see an improvement and they're continuing to see an improvement as they stay on their autoimmune template, we continue to hold that steady. If they feel like they're flatline with just the food changes alone, we'll start to reintroduce one food every 2 to 4 days, 2 to 3 days or so, smaller amount on day 1, little more on day 2, little more on day 3 or 4. And we'll add them in slowly one at a time. Egg yolks before eggs, egg yolks before eggs, ghee before butter, 1 nut, 1 seed, 1 nightshade at a time. And we'll reintroduce it that way. Any negative reaction, we'll pull it out. So if you've hit that flatline phase, then you would want to follow that protocol. And that's the diet reintroduction handout that's in the members area for patients. Okay, excellent. Let me just hit this last question here. Midwest Moldy writes in, have candida overgrowth from living in a moldy house, have malabsorption from bacteria and fungus overgrowth, plus I have no thyroid gland, high reverse T3, leptin high as well. Yeah, you got to go through the 6 R's and you got to get worked up by a good functional medicine doc to address those. A lot of issues to address at one hit, but that'd be your first step. Mike M writes in, ferritin is at 486. Best way to be sure it's iron, not inflammation. Look at your other inflammatory markers. How's your CRP levels? How's that? Do you have any pain or excessive inflammation in your body that you can feel? Go give some blood. See if it drops the following time. Those would be a couple of ways I would look to see if that's an issue. And then Adam writes in, can food allergies cause hair loss? Every doctor is saying it shouldn't, but be that serious. Well, it depends, right? If the allergy is causing inflammation and the inflammation is making it hard to absorb key nutrients for hair health, like fats and proteins and collagens and minerals, yeah, it could definitely, any type of gut stressor could potentially lead to a bottleneck in absorbing key nutrients that are used as building blocks to help repair skin, hair, nails, etc. So I hope that helps. And then Josh writes in, thanks for doing this rapid fire question thing. It seems difficult. Well, it's definitely tough, but I mean, I've been doing this stuff for decades and really learning about it and owning it. And this is what I do all day long with patients. So all I do is get rapid questions like this all the time. So it's a skill that you just get better at over time, but I appreciate you acknowledging that. All right, y'all. Hope y'all had a great Monday here and you enjoyed some of the questions. I appreciate it. Give me a share, give me a thumbs up, give me a like. Make sure you subscribe to get notifications. I'll be back hopefully this Friday with Evan. We're supposed to do a podcast today, but I ran late. If not, I'll be back mano y mano, and we'll have a nice little talk like this again. Hope you all have a phenomenal Monday, and we'll talk soon. Take care. Bye.